Hello, my fellow ophthalmic nurses, intending ophthalmic nurses, student nurses, students who think of venturing into the ophthalmology world. Come, let's have a heart-to-heart talk. Let's talk about what it is like working as an ophthalmic nurse in Ireland. Is it worth it? Is the pay good? Do you get good money for working in ophthalmology? How is the workload? Is it something that is so stressful? How many patients do you see in a day? Do you have any career growth? Do you stand to gain anything working in ophthalmology? Now, first of all, if this is the kind of video you're interested in, don't forget to hit the subscribe button. Turn on your notification bell so that the next time I post an interesting video like this, you'll be the first to know. Have you done that? Let's do this. Now, my name is Ndowe, so I am an ophthalmic nurse, registered general nurse, registered ophthalmic nurse in Nigeria, currently working in Ireland as an ophthalmic nurse in the eye department. So, what does it feel like working as an ophthalmic nurse? So let's start first by saying who an ophthalmic nurse is. As some of you may already know the definition of a nurse. Now, so add ophthalmic, which is eye, to that. So as an ophthalmic nurse, before you become one, you have to have gone to do the training in an accredited institution and pass all your exams and get your license to practice as an ophthalmic nurse. That's what or who an ophthalmic nurse is. So how long is the training? In Nigeria, it is a 12 calendar months training. It starts in November and ends in November. As we all know that Nursing Council final qualification exams is always on the first Tuesday of every November. I don't know if that has changed, but that was what it was during our time. What training you get? So you get things starting from the anatomy of the eye, the disease conditions of the eye, how to manage emergencies and pathophysiologies of every other thing, and then you move into the operative part of it where you learn how to scrub and assist the surgeon in various kinds of eye surgeries, eye procedures and stuff like that. It also migrates to you learning to use all the diagnostics equipment, which ranges from checking your patient's intraocular pressures to doing their scans. There are various scans, most of which I wasn't opportune to get back home, which is one of the things I'm grateful for coming here. And it also extends into like community care. You can care for patients in the community that have some eye problems. You can see, as an ophthalmic nurse, you can see patients who have eye issues, refer them, prescribe some medications for them, and it will be acknowledged. So there are a lot of things you can do as a trained and a registered eye professional or eye nurse. Because the word eye professional comprises of a whole lot of professionals. There are so much to do in the eye department. So now I got the training back home in Nigeria, and luckily for me, I was opportune to work in the eye clinic. Okay, so I am currently working in the eye clinic back home. I was also working in the eye clinic, eye ward, eye theaters. I also have opportunities to assist surgeons in doing some eye surgeries, community surgeries. You know, there are a lot of things you can do. Sometimes we are being limited by many things, most of which is finances and just the knowledge that this is something you can do. Now let's move from there and coming here what it feels like. Is there anything you gain especially for working in the eye department? So in Ireland, they have what they call specialty areas where you stand to earn location allowance. In Nigeria, that can be referred to as a specialty allowance, where people are paid like call duty and stuff like that. But here they call it location allowance. So every month I earn what is called location allowance. It's not quite much. That's about 200. You know, the salary here does not stay like we have back home in our various countries, where if you are earning 2,000, that's what you'll be earning every month. No, it changes because of the working hours, because we are paid hourly here. So that location allowance, as at present, my salary earns between 200 euro to about 222 euro. So some month is 200, 220 to 215, and you know, it varies like that. Okay, so that's one of the perks of working in the ophthalmology department. Now let's come to the workload. Now, ophthalmology is one of the fast paced environment that you can ever think of in the hospital community. It's a department that you can have 200 patients today, and tomorrow you come and you have none. I know you are surprised, but that's the way it is. And when you have 200 patients to see, you have to be as fast as possible. And guess what? Most of these patients are like very little or very old. So people of the middle age, they are there as well, depending on what they are coming to get done. Because there has been a lot of advancement, especially when it comes to the refraction, vision, lasers. So many things are happening in the eye department. So it's really fast paced. You need to be ready to work as fast as you can. Some days slow and steady, and the next day you go your 100, 150, and you have to take care of everybody and still attend to their needs, where you have to constantly adapt to the changes that is going on. So if you are not someone that likes to work very swiftly, then ophthalmology or ophthalmic nursing may not be for you. Your hands is like the most equipment that you use, if I want to say it that way. You're constantly touching, and one of the things you need to have as a should I say a personality or something like that, is that you need to be very, very gentle. Call it dexterity. Yeah, you need to be very, very gentle with your hands, because the eye is one of the organ that is very, very sensitive to touch. Anything that goes there, it blinks, and you want the eyes to be open, you know. So you need to be very tactful, very gentle, very dexterous, and very calm. Almost all your patients, you're teaching, you're doing, everything happens all at once. So you need to know a lot of things to prepare to see a particular patient, because most times, especially people here that are very inquisitive, they want to know what you want to do a scan for them. What they want to know. What scan is that? Why am I getting it? What are you seeing in the scan? If these things describes you as a person, the joy that you see when a patient that has been blind for a while because of especially cataract is coming and then taking the cataract off, and the next day they just open the eye shade and the patient open and say, oh, I can see that. Oh, and you see the joy on their faces. So it's a specialty you can see the progress of what you're doing very quickly. It gives a lot of satisfaction, especially when it is a condition that is treatable or that is curable. It is also a department that can make you feel so depressed, because sometimes the conditions are not treatable, and most times may not have been preventable. Something like glaucoma, especially when patients can stay and then it gets to an advanced level, and then they come in with the hope that they are going to get some good news, but unfortunately they are not able to get that, and you see the sadness, you see the disappointment, and even within you, you know there's nothing you can do for this person. But I'm very thankful here. A lot of innovations are going on, even with the treatment of glaucoma, because of the lasers they have that they can do. They don't necessarily need to go straight into surgery like they trouble. That's a lot of things to say in this video. I'm just doing the the intro into ophthalmology. But all I'm saying is it's a department or a specialty that can make you feel so satisfied in one point, and then the other person, it makes you just feel you want to quit, because especially if you are passionate about what you do, if you are empathy, if you have empathy about your patients, then you tend to like feel what they feel at the time. Like the refractive surgeries where patient has been wearing a spectacle for the past 6, 7, 10, 20 years of their life, and then they just come and get the laser surgery done, and the next day they can see without their glasses. That one is very, very interesting. I never knew. I used to watch that online, but when I come here to see it, it's something that is very, very fulfilling to me. So yeah, I love it here. That doesn't mean I will not try out any other specialty here, because I love to be challenged. Sometimes it can become a routine. When you are in ophthalmology for a very long time, it can become a routine that you get used to a lot of things, and it doesn't excite you anymore. So that's why I'm saying I can always look forward to doing other specialties, but ophthalmology is good. So if you are comfortable to fit into a very fast paced environment, then and then you are gentle with your hands, gentle with the way you speak, gentle with have this empathy, because you can just want to do a procedure for a patient and the patient starts crying. You ask a patient to read, especially the visual acuity, and they look at it and they know that when they came the last day they were able to read beyond certain line, and today they are not even to see certain lines. They start crying, like they start crying immediately, and you don't just don't worry, don't everything is not fine. Everything is not fine, because here I've noticed that they mean everything you say. You have to mean it. Don't say what you don't mean. So like back home, somebody can be crying, you don't worry, everything will be fine and it's okay, but here it is not. The person will tell you no, it is not, everything is not fine, because I can't see, and you are telling me everything is fine. It is not. So you need to be very actually tactful in your communication. I'm still learning on that, because where we come from, our communication skills is a little bit different to how it is here. So I'm still adjusting into it, and I'm loving the challenge, to be honest. So yeah, that is what being an ophthalmology nurse looks like. So in terms of money, it's a location allowance, and then your normal salary is just your normal salary, and then the work pace, you get to work with different professionals, the ophthalmologists, the laser surgeons, and it's a lot, and I love it. Okay, so if it's something you're interested in, just check it out. You never can tell, you might love it too. Yeah, check it out.